Attention deficit hyperactivity disorder is a neurodevelopmental clinical condition that is heterogeneous in presentation and also comorbid with other psychiatric conditions. There are two main components: heightened impulsivity and hyperactivity, and deficits in attention. Heightened impulsivity and hyperactivity looks like excessive speech, fidgeting, and restlessness, while deficits in attention look like careless mistakes, lack of follow-through on tasks, and disorganization. The prevalence rate of persistent adult ADHD is 2.58%. This refers to ADHD that was diagnosed in childhood. And symptomatic adult ADHD prevalence rates are around 6.76%. Now, this is partially much higher because this refers to people who did not receive diagnosis until adulthood. Prevalence rates of ADHD in males range anywhere from 2.1% to 3.2%. This is in contrast to females, which the prevalence rate range from 1.1% to 3.2%. Adults with ADHD often experience more deficits regarding higher level executive functioning and emotional regulation in comparison to children. Also, adults with ADHD attend college much less frequently than adults who do not have ADHD, and also they have lower occupational status. People with ADHD often experience difficulties in interpersonal relationships as well, and at a community and societal level, adults with ADHD are arrested at higher rates, have increased risks of motor vehicle accidents, and negatively impact healthcare infrastructure. This is a list of different interventions for adult ADHD. The first approach I want us to focus on is dialectical behavioral therapy, otherwise known as DBT. DBT is a cognitive psychotherapeutic model that was originally devised for group settings to aid in emotional dysregulation and relationship difficulties. DBT skills training, adapted in the following studies, consists of 4 modules surrounding different skill groups to target functionality, mindfulness, emotional regulation, interpersonal effectiveness, and distress tolerance. DBT as a potential treatment modality emerged in the earliest 20th century, with a pilot study regarding a structured skills training to work in tandem with medical therapy. Participants who received the DBT skills showed marked improvement across the self-report scales and decreased severity of ADHD symptoms. In a pilot randomized control trial, Fleming et al. 2014 evaluated DBT as a potential intervention for college-age students with ADHD over the course of 18 weeks. After the conclusion of the intervention period, students assigned into the DBT condition showed much greater treatment response rates and clinical recovery rates of ADHD symptoms and executive functioning. However, the randomized control trials regarding DBT do have relatively small sample sizes, so generalizability and statistical power are affected. Much like other psychotherapeutic approaches to adult ADHD, the inclusion of medication often complicates delineating any clear causal relationships. Many of the randomized controlled trials involving DBT often either utilize a placebo condition of just treatment as usual, which refers to medication usually, or passively notes medication usage as a demographic component. Though in all of these studies, DBT was linked with decreased ADHD symptomology, there continues to be a dearth in the literature surrounding DBT as a singular treatment or a comparison between DBT plus treatment as usual and just DBT. DBT is a burgeoning level B intervention, as it does pull upon randomized controlled studies, trials, and quasi-experimental studies that indicate DBT as lessening symptom severity. While this inclusion of medication can make it difficult to interpret any sort of causal relationship, it does appear that they do improve in improving functionality and lessening symptom severity. And this intervention would definitely benefit from more extensive study into DBT without medication inclusion, and also larger sample sizes to truly parse out a causal relationship. While DBT is definitely not the most popular option, it is increasingly being used in the literature alongside psychoeducation, CBT, and mindfulness. The second approach I want us to talk about is acceptance and commitment therapy, otherwise known as ACT. Acceptance and commitment therapy is a third way psychotherapeutic approach that seeks to address behaviors through thoughts, feelings, and internal experiences. Acceptance and commitment therapy's goal is to increase psychological flexibility through the 6 core processes: acceptance, diffusion, self as context, contact with the present moment, valued living, and committed action. ACT interventions are a relatively new field of study, especially for the adult population. Currently, research does fall upon theoretical connections between ACT and other neurodevelopmental conditions like autism spectrum disorder and preliminary studies. However, ACT is a promising new endeavor into the field of interventions for adult ADHD, especially because, like DBT, it seeks to address the psychosocial and interpersonal component of ADHD management, not just the cognitive element that is often the primary focus. Siri et al. 2023 compiled feedback from 49 adults with ADHD who were enrolled in the Understanding and Managing Adult ADHD program, an online intervention combining psychoeducation and ACT. According to the compiled responses, psychoeducation with ACT was positively related to increased self-acceptance and comprehension of maladaptive behaviors. In addition, Fullen et al. 2020 conducted an exploratory study regarding a manualized form of ACT with adults with ADHD over the COVID-19 pandemic. 12 adults did complete this program, and there is significant improvements on outcomes related to self-reported mood, anxiety, and psychosocial adjustment. However, this treatment approach does have a very tentative classification for me as promising. There is some emerging research that indicates positive adjustments in regard to mood and psychological interpretation. However, there is no firm data surrounding the impact of measurable ADHD symptoms. As of right now, ACT is just a level C intervention for adults with ADHD symptoms. There is no randomized controls trials that I could find or quasi-experimental studies that investigate this intervention, just theoretical and mixed method approach studies. However, that's not to say that ACT could not be helpful for our practice as social workers, as seen in the Siri et al. And the Fullen et al. Articles. ACT, utilized in tandem with psychoeducation and also other programs, can be useful in positive mental health and psychosocial adjustment. While there is a vast field of research surrounding adult ADHD, there are still some gaps in the research that hopefully can be filled in the coming years with new research. Currently, there is a dichotomy in treatment and diagnoses in regards to adolescents and adults. Contextually, adult ADHD is still a relatively new phenomenon. In the past, popular scientific consensus regarded ADHD as a developmental disorder, something that usually went away by the time adolescents reached adulthood. However, since evidence directly refutes this, and actually indicates that ADHD is present all across the lifespan, diagnoses and interventions have had to be adapted to fit the adult profile. Currently, in the DSM-5, the diagnoses table for ADHD only focuses upon children, and clinicians need to adapt that profile to fit adults often. Also, popular interventions such as medications like methylphenidates and amphetamines really only had clinical trials that detailed the effects in children. So they had to be adapted and studied again in adults to see the health impacts of it. This is also apparent with psychotherapeutic approaches that were more helpful for children in comparison to adults. Also, touching upon medication, in regards to interventions, many of the psychotherapeutic treatment modalities still rely heavily upon a medication approach to create a multi pronged treatment. As a result, there is a lack of established causal relationships for treatments like DBT and CBT, and also consideration for those who are resistant to medication, maybe for personal reasons or also health reasons.